I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. Welcome back to CEO Live Talks. I'm your host, Dr. Swannie Jett. We're going to continue our conversation with Mr. Brett Bachman today. So, I'm curious because you have a very particular lens to help people that don't have a voice.
Yes.
Right? So, how did you get that lens? What inspired you? Because something had to happen.
I was in a fraternity in college called Delta Chi. Mm-hmm. And I read this passage, and I can't remember it. At that time, I had it memorized.
Right. You're supposed to have.
Yeah. I can't remember exactly what it was, but Sir Edward Coke was talking about, and he was a knight, or talking about knights, mm-hmm. and a lawyer and a barrister, and he said, when he was talking about barristers, the knights of old put down their swords and shields and picked up the book of law. And so for me, I didn't know at the time, and I suppose that's probably why I was called to law school, but I've always, even since I was a little bitty, if I saw somebody get picked on or anything else like that, I remember, when I saw this kid that was getting picked on by, he was in the 8th grade and I was in the 6th grade. Mm-hmm. And there were like 3 or 4 of them. I just ran in and charged. I've never really thought about that. And so linemen, protecting, mm-hmm. that kind of stuff. So I think that's kind of what my calling was. I just didn't realize it. That's right. Why I went through. But I also believe that there's a path, and everything that you've done in your path, whether they're mistakes or not mistakes,
right,
that sets you up for where you're supposed to go. And so for me, I think that it's our responsibility, if you have access, right, and a little bit of power, or the ability to make your voice heard, is to help those that don't have a voice,
right,
and that are trying. I always believe that if somebody's trying and you can help them, that's what you want to do. Now, there are some people that just give up and they don't want to do anything, and they just want to say, help me, but they won't help themselves.
You got to put forth the effort.
Yeah. If you do that, that's like why, 9 years ago, after I've been at Heuser 10 years, mm-hmm. I instituted a program called Listen Up. And what we do is we provide hearing aids, mm-hmm. to people who are volunteering in their community, for free. Because if you're willing to volunteer and help your community, and it could be a nonprofit, it can be church, right, doesn't really matter. As long as you're willing to do that, we will. Now, we can't do a ton of them,
right,
but we do as many as we can to encourage people to get out of their homes, be part of their community, because I personally believe that unless we have communities where we're all talking to each other,
right,
in a way that we're not saying, you're bad and you're evil, or you're this or you're that. Right. But honestly, talking about things, that is the only way we're going to get through, let alone what's going on in the Middle East, but get through all this division that we have.
You got to have conversations. You got to have, you got to be agreeable, get on the same page.
Right.
Even from different sides.
Well, I have best friends that think polar opposite of me.
Yeah.
And we have discussions, and we'll never agree on different ways of doing things.
Right.
But I don't think of, like, this one particular friend thinks of things, and I was like, I don't agree with anything that you say, but right, I know who you are, and you honestly believe it. You're not doing it because you're trying to get over on anybody or trying to do this. You honestly think that this is the best way to do it. I may disagree with that.
Right. But you're listening to
yes. And there are some times where I go, that's a good idea. Let's try that.
Right. So how did you land at the Heuser Institute? Because that's another shift.
It is. It is. So with my dad coming back here and starting a film festival, it's called Louisville's International Festival of Film. Mm-hmm. I helped him set up the organization that runs it, which is a gives back, and in fact, it funds our art program at Heuser. Does a lot of different things, and because of that, I got to know a lot of people. I knew Mayor Fisher back in the day. I knew actually Mayor Fisher before he was mayor.
I did too.
Yeah. And got to know Steve and Andy Bashir when they were in office. And a lady by the name of Lisa Siebert is a good friend of mine. And when I was thinking about what am I going to do? Do I want to go all in Los Angeles and buy a home in Santa Monica and be in debt for the rest of my life and the next?
Especially out there.
Yeah. Or do I want to try and say it? And my brother actually had said, you know, California's changed a lot. Los Angeles has changed a lot. I don't know that I want to raise our children there.
Right.
So let's all go get a job in Kentucky. You know a lot of people. So I reached out. A lady by the name of Lisa Siebert knew some people on the search committee. And so I got my resume in. I got some letters of recommendation, one from First Lady Bashir's office, a couple others, and next thing I know, I'm interviewing with all the CEOs from the hospitals. They were on the search committee.
Wow.
Because Heuser was looking at finding somebody that knew how to run a business, and but had the passion for helping people,
right,
and knew a little bit about school.
Mm-hmm.
And because I had been handling IEPs and handling school stuff through my law practice for a long period of time, that was a checkbox.
Perfect
and then
candidate.
Since I ran my own law firm, that was a checkbox.
Okay.
And so I knew how to run a business, and because 501c3s or nonprofits are businesses.
It's a business.
Anybody who doesn't think that it's a business, the nonprofit, and you're doing a disservice to the people you serve if you don't run it as a business, because if you go out of business, they have nowhere else to go.
They have nowhere else.
Right. So that's what they were looking for. I think 2 weeks later, I was selected, and I moved into the Galt house for 2 months while I was looking around, and and then wound up moving into a friend's pool house. He said, "Yeah, you can stay in the pool house." And before I saw it, I was like, "I can't stay in any pool house." And
not nice to have a
it's
pool
almost
house.
it's almost as big as the house I'm in now.
Right.
And stayed there. He said, "You have 6 months."
Oh wow.
And so the day of 6 months, I bought my house.
Okay.
And it's been, I love where I live. I love the city of Louisville. I think that there are some opportunities for growth for this city. I know,
Definitely.
That universal preschool, like I was telling you, I just joined the Pritchard committee that, their goal is to improve our public education all the way from early education all the way to post-secondary, and our education stuff. And part of that, I'm on the mayor's early learning action group. And so we've been with a lot of very talented others, a lot of them a lot smarter than I am, and kind of help design what a universal preschool is. Because as you and I were talking earlier, I firmly believe that how we can start to close our gap
Should be free.
and should be universal, because and quality,
Well, got to be quality.
Yeah, because if you have money, you're in a quality preschool. Those children are given all the skill sets they need. Our job as adults is to make sure children are given everything that they need to get through. Not because it's not their fault if they are born poor.
Right.
Our job as a society is to help that.
Some people think that it's their problem.
I know. But and the thing is, there's a lot of stuff that goes attached to that. But I think, with preschool, if you look at it from just a self-interest point of view, we're helping ourselves by helping them.
Of course.
Okay, because otherwise we're taking care of them.
That's return on investment.
Well, yeah, and then helping our public schools meet their mission.
Right.
I was just talking about this the other day. Gone are the days that you could drop your kid off in a public school environment and expect that they're going to exceed all goals.
Right.
Okay? It's just not possible anymore. Public school's not funded to do it. And again, they're not legally required.
Right.
You know, there's the legally required minimum, and they've got a ton of students that they all have to take care of.
Right.
All the teachers are amazing, and everybody really wants to do it, but you only have what you have.
Right.
That's why, you know, with this Pritchard committee, we started talking about business leaders for a strong start, and that's not the exact name. I'm sure they're all going to yell at me, but I just joined. You know, CEOs for a strong.
You got grace.
Yeah.
Mercy.
Yeah, yes. But you know, we had our first press conference talking about it. There's like 30 or 40 CEOs, and I'll be talking to you a little bit about talking about the importance. And you know, the mayor's committing some funding to it.
Mm-hmm.
It's going to need some other funding. You know, look, I'm not a big
public-private partnership.
Yes,
You need that.
because if you just think about what we've done with JCPS, and right now we have a public-private partnership. We're an entity, so we take what JCPS provides that's legally required, and we add $1 million on top of it for these kids that are born deaf.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park DuValle Community Health Center. Ever since I started at Park DuValle over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hi, I'm Destiny. I'm the Community Health Workers Manager here at Park DuValle Community Health Center. This is my team of community health workers.
Community health workers close care gaps, reduce barriers to care, and address health disparities in our community.
Community healthcare workers act as a bridge between the patient and the provider to stay engaged in the healthcare plan.
CHW strives to work as committed care team members for PDCHC, for current patients, and to provide access to those who need a new medical home. For more information, please visit pdchc.org or visit one of our centers. Thank you.
Walk me through everything that the Institute does, because I don't
that's a
think
lot.
a lot of people really know.
Yes. Well, I'm still learning things too. I just realized after 10 years we have a sprinkler system. And so we just found it. It's crazy. So we started out as a nonprofit called Louisville Deaf Oral School. And it was designed around being able to help kids communicate that were born deaf. Now, ASL is a beautiful language, and it's its own language, and we still have ASL at Heuser Hearing and Language Academy, and we taught it at School for the Deaf. But most children who are born deaf are born to hearing parents.
Okay.
And they generally do learn ASL, but they want to mostly will want their children to be able to experience that as well, being able to verbalize.
Right.
And so, you know, that's part of what they were teaching them to do, was to evoke language and have them to at least talk. Technology has changed a whole lot since 1948. There's cochlear implants, there's bone anchored
Thank
hearing
goodness.
devices, and all those things. And so what our goal is, if a child comes there and their parents want them to learn language and learn not ASL, which is a language, and
Right.
we teach in that, but also be able to become verbal, then we work with that. And so what we do is we take, when they're in public school, We have some teachers from JCPS, and we supply everything else. Supply the building, the technology, the extracurricular stuff that we do, the extra speech, extra really intensive therapies from 3 to 6.
How many schools are you in?
Well, we have our language academy for deaf or hard of hearing, but we do speech and hearing screenings now with 9 private schools. And actually, we're working with public school. One of our board members has adopted an elementary school called Maupin.
Yep,
And so we'll go in after the kids are screened and kind of help remove barriers for hearing health care. Part of what this gentleman and his wife want to do is they picked a school and see, can we remove all healthcare barriers for this school?
Okay.
For everything, whatever it is, vision, hearing, that kind of stuff. So they asked us to help, and we're working through that. And the difficulty, and this is where we get back into large organizations.
Right.
They can't move fast. Being in the military,
So you got to have the right particular leader.
Yep.
In order to break down the barriers to move fast.
Right, and they don't, and so we do, and that's our partnership with DuValle. We have one with them too. What I love about the public-private partnership with a nonprofit, is that we're agile. We can move. We can move faster. I don't move as fast as I want, and my staff will tell you I move too fast. But
I get that complaint.
We can do things, whereas school board, this and that, they're all doing the very best. And, we just went through, well, we all know we went through, I don't want to say the P word,
right.
But pandemic. But, and those kids all of our children got devastated.
Right.
If anybody tells you any different, they didn't.
So tell me the statistics, because, a lot of people are not aware of the demographics, the statistics of what you see in the community, and why are you investing so much?
Hearing loss and deafness is the #1 birth defect in the country. Right? It's 3 or 4. It's 3 or 4 out of every 1,000 births across all socioeconomic status.
Right.
Okay, hits everybody. There's a lot of reasons for that.
Right.
Now, undiagnosed hearing loss is more prevalent in socioeconomic challenged areas and minority populations.
And so
that's why we're going in and kind of making sure that we're investing in the West End to talk to people, because part of what I learned in my law career, there were times when I was representing a parent who had a child that was on a behavioral intervention plan.
Right.
And so there was one time when I was talking to one particular client, and he was 8 years old, and I was talking to him, and just kind of like this, and I thought maybe autism or ADHD, and then I realized I was talking to him from behind, and he wasn't hearing me. But he had passed his hearing screening, and so he had developed hearing loss from infections and for things like that, and hadn't gotten caught. And the reason why he was having behavioral issues was because he wasn't hearing the teacher, so he wasn't engaged, so he was like, well, I'm just going to act out. But once a child gets put on a behavioral intervention plan in public school, it's really tough because it follows them.
Right.
So then you got to say, okay, it was the hearing loss, and we'll treat the hearing loss and do all that other stuff. And that happens quite a bit. And so what we're engaged in the West End is, particularly in African American populations, hearing's not been a priority.
Right.
And there's not a lot of audiologists in town. There's some great audiologists that do it, but we're the largest nonprofit that does it. And then there's the Commission for Special Needs Kids that does screenings and things like that. And JCPS has 2 audiologists that does screening for their population. So we do a lot of that, kind of go in and then activate the parent about, all right, child does have hearing loss, they're not deaf, this is something that is treatable with hearing devices, and we'll go through Medicaid or, and for the parent, if they have hearing loss, voc rehab. The statistics that I found when I wrote an article several years ago, right after the pandemic, what we realized is, when it comes to the African American population, is they're more likely to go get a hearing test, less likely to be able to get a hearing aid. Whereas Caucasians, less likely to get the hearing test because they don't want them,
Right.
but more likely to be able to go get a hearing aid, just because of the economic differences and stuff.
Right.
And so on average, if a person has hearing loss and is untreated, they earn $14,000 to $15,000 less per year. They're less likely to be promoted, less likely to be hired, more likely to have medical misdiagnosis because they're not hearing. And so, but they're nodding. And so people at work are like, well, that guy's just not that smart, or that gal's just not that smart. And so that's kind of why we do the screenings. And our mission now is to do 10,000 screenings a year, both in the West End and in rural Kentucky, because we just bought mobile clinics.
How bad is the problem in Louisville and the West End? Because I think people don't really understand the magnitude.
Right.
And especially if you talk about people not being screened, or they have some type of behavior issue, not realizing it's related to not being able to hear.
Right. In general, I don't have those statistics. I do know that when we've tested schools, and not in Louisville, but we've gone in and tested an elementary school. I try and say JCPS does a great job.
Right.
But when we've tested schools, a particular elementary school, we tested 80 kids and 20 had undiagnosed hearing loss. Now, day by day, that could change. We went back and did a full test in a booth after the screening, and like 4 of them had issues that needed to be treated that hadn't been caught. Okay, so it's significant enough that for that one child, it's a game changer. But in general, hearing loss is more prevalent in adults than it will be in children. It's just that when you don't catch it as a child, they lose all their education.
Hi, I'm Destiny. I'm the Community Health Workers Manager here at Park DuValle Community Health Center. This is my team of community health workers.
Community health workers close care gaps, reduce barriers to care, and address health disparities in our community.
Community healthcare workers act as a bridge between the patient and the provider to stay engaged in the healthcare plan.
CHW strives to work as committed care team members for PDCHC, for current patients, and to provide access to those who need a new medical home. For more information, please visit pdchc.org or visit one of our centers. Thank you.
Hi, my name is Swannie Jackson. This is Shakoya Gurton, and we're both medical assistants here at Park DuValle Women's Health. We specialize in pregnant women, mammograms, ultrasound, and any vaginal complaint. So we offer free pregnancy tests. We offer glucose testing for our patients who are 27 weeks pregnant. We offer mammograms if they need one, if they find any lumps in their breast. And we also offer ultrasound if there's any abdominal pain or a pregnant patient. It's important for our women to keep up with their bodies, because if they was to have a lump in their breast and they don't perform monthly, everyday breast check, it could be a lump there that may need a mammogram, and we could catch it just in case it's cancerous. You can contact us at pdchc.org, or you can call 502-774-4401, extension 1142.
We are here in the community. We partner with our community health workers to run vaccination clinics throughout the city of Louisville, specifically downtown and the West End. The importance of events like these is that a lot of people have transportation issues, so we are able to come out into the community and get people the vaccinations that they need.
So it's really important to have these type of events in the community because, as we know, when COVID and flu season comes around, our underserved communities are hit the hardest. So if we can bring any vaccines or anything that they need, glucose testing, it's important to meet people where they're at.
At Park DuValle, we care about the community. We do events like this monthly because we are the community and we love to give back to the community.
Be sure to visit our website for more of our upcoming community outreach events.
For more information, visit us online at pdchc.org.
While everybody's listening, one of the things that I want to do is to bring your services in-house to Park DuValle,
Yes.
because I think that is essential. And we right by Moppin as well.
Yes.
So talk a little bit about, as we close the show, me and your partnership was created through a mutual friend,
Yeah.
Mike Jennings.
Yep.
So talk a little bit about that. Because again, we talk about relationships.
We did, and that
Right.
that is a prime example of about how relationships evolve, because we connected.
Right.
Somebody connected us, and it could have been, well, I need this, and you need this, and that kind of.
Right.
But we talked, and we're like, wow, this is an interesting cat. I want to talk with him. I want to chat, and and then we've seen each other since then, and we have great conversations like today. I mean, I don't even feel like I'm being interviewed.
Right.
This is just a conversation.
Right.
And who am I to be interviewed anyway? I mean, it's crazy.
You're the world's most interesting man. Second commercial.
If I only could grow a beard like that. And so, what we want to do is help provide screenings, audiological care.
Sure.
Now, we have purchased a mobile booth that is being built and finished, and that we can just roll into your parking
That'd be
lots
great.
on day for you, not just the kids that you're seeing,
Right.
but we could screen their
Adults.
family and their
Yeah.
friends and do that quarterly, do those kinds of things. So, like, a lot of people find out they have hearing loss and they don't want hearing aids, but for me, what I want them to do is to be able to make an informed decision. Like,
Right.
everybody should have some sort of hearing test, 40s, 50s, especially those of us that were in, nightclubs or bouncers back in
Right.
the day.
Right.
And so I think that being able to have that at Park DuValle, especially the different locations,
that would
is
be
exactly what we want to do. I know we're going to be doing that. I know your team and my team are working on it. Hopefully that's something that we can sustain for
I think
the
that
rest
would be
of us.
great.
Yeah.
Also, we're going to do COVID tests and COVID screening. And,
Yes.
And vaccines. So.
Well, absolutely. I mean, post-COVID syndrome
Right.
is something a lot of people that have had COVID have some balance issues now, or they have ringing in their ears with tinnitus. So, I mean, we treat tinnitus, we treat vertigo and balance and anything that's ear-related. In fact, a lot of neurologists refer to us to rule out the ear to
Right.
make sure that it's not, and then we can refer back and forth. I think there's lots of different synergies that we can offer for your patients, the communities that we all serve together. I mean, we see like 6,000 patients a year. And so
That's a lot.
through our 5 locations. And I think that and I just got the final numbers back with our Kentucky Hears program, which is what the state decided. In the state of Kentucky, we're highly ranked when it comes to identifying children with hearing loss at birth, because by law they have to be done at the hospital. But we're 51st in those same children graduating from high school.
Wow.
All right, so one of the territories is ahead of us.
We bad. Yep.
And then we're double the unemployment for people with hearing loss. And
Wow.
so I think what we're trying to do is workforce starting. That's why we're doing some school-based stuff out in rural Kentucky. We're in 20 counties now.
Got to close the gap.
And then, but that's not to say that the West End doesn't need, it does. I mean, Louisville, there's areas of Louisville that really need this help
We
too.
haven't tapped into.
Yeah.
Well, I want to thank you for coming to the show today.
You got it, brother.
And good afternoon. This concludes the show. See you again next week.